complaints or concerns about that. And we went to the health authority and explained why we wanted that changed, and they went along with it. And so we've made a change. And we can do that where things make sense, where you tell us it's not working, or you have a better idea of how to do something. Get that to us. Let's have that conversation and work through this, right? None of us has gone through anything like this before. We're all learning. And so bring those to us and we'll do it. But for now, I wish I could give you a date or a criteria, and I don't have it. And I'm sorry, I really am.
So our next now our top question is, are there any changes to sunscreen regulations? We have we have parents wanting to spray sunscreen because they do not want teachers rubbing their children down for fear of spreading germs. I have been telling them no spray sunscreen, but I wanted to check.
Tammy, could you help us out with this one?
Well, there haven't been any changes to sunscreen that I'm aware of. And I know we were asked that question last night with our certified family providers. And it was one of the things that we need to follow up with the OHA, because I'm not aware that we have that represented in any of the documents, Amy. So I think we need to do some follow up on that.
So, okay.
Well, as of right now, spray sunscreen is still not allowed.
Okay. So like Tammy said, we will go to the OHA and we will work that internally and see if in this circumstance, because of what's going on, does it make sense to change that for the time being?
Okay. I know folks really are still kind of have additional questions about exclusion. So if one child or staff member exhibits COVID symptoms, is the entire stable group and the staff who have interacted with them excluded for 10 days and at least 72 hours with no symptoms?
So all I heard there was the COVID symptoms, right? So I want to reiterate, the exclusion stuff starts when the person is sick and they have a symptom. So we get a lot of this, well, what if the kid just has like a little cough? They have asthma, they have allergies, they're coughing. No, they need to be sick and have one of the symptoms. So that's the first thing I would say. But if the child is, let's say, sick and has a symptom, right, go back to that structure we talked about where the person needs to go home and get tested. So that's the step that we take. No, you don't have to shut down immediately and send everybody home. Take it through the steps. Person goes home, get tested, stay out for the amount of time, the 10 days or the 72 hours, like we said.
So, oh, go ahead.
Follow up, because I actually still have a question on this too, and you're much more an expert on this than I am. So the child goes home and gets tested and is found to have a case of COVID. So that group that child was with, the group of 10, then has to go home and quarantine for 10 days or 14 days, which is.
Yeah, so you know what I'm doing? I'm going back to my slide and looking at it. I know you all can't see my slide, but I can. So exposure to person who tests positive for COVID-19, then folks need to go home and quarantine for 14 days. So I will tell you that our awareness of anyone in childcare getting a case of COVID-19 is minuscule. Now, folks aren't required by law to report to us, but as far as we know, it's been an incredibly rare situation, which I will say I think is a testament to how well providers are doing at, paying attention to the guidance, to working on keeping kids separated, to the hygiene. All these things are going on. It's incredibly rare from all we know.
So here's another question sort of related. So if a family or a staff goes on vacation, is there a time they need to quarantine before they can return?
So there isn't anything that says folks need to quarantine after they've gone away somewhere. I would point folks to, I think there's some CDC guidance on whether if people go like overseas to a real COVID hotspot. I'm guessing people aren't doing a lot of that. So anyway, no, if you travel, there's not a requirement that you go into quarantine.
So I think this is a stable group question. So would it be possible to use a room Monday, Wednesday, Friday for one stable group and then the same room on Tuesday, Thursday for another stable group?
Yeah, the answer to that is yes. So they have to be truly different stable groups, right? You know, you've got one set of 10 on Monday and a completely different set of 10 on Tuesday. Do your cleaning between those groups, right? But then yes, you can do that.
So do we consider a director a floater? So when the center director is present, are they considered a floater?
Tammy, do you think you can help us answer that question?
I would say if the director is going from room to room and helping out, then the concept that you are going in with different groups of children apply, and you really need to be wearing a mask. If you're a director who is not going from room to room and helping out, then no, but I think that most directors do, because how else would you know what's happening in the room? And you're also there helping children that are having a hard day, or when a teacher is needing a little extra support, you're providing great breaks. So if you're going from room to room, then yeah, you really do.
So a question around why are teachers not required to wear masks? And it says like how to clarify this for parents. So I think it's like, what might folks be able to say to parents about why teachers are not required to wear masks at this time?
Yeah, well, I mean, I think there's one thing that, you know, masks are definitely an option, but are not required. So I think we have this situation of, I refer to it as, you know, competing priorities or competing values. So we've even got a lot of pushback or you know, concern, I guess I would say, about the idea of the staff who are performing the health checks needing to wear the face masks. And the concerns have been around, you know, some of the kids are really afraid when I wear a mask, or, you know, they get anxious or whatever. And so, so that is one concern for sure. The competing concern or the competing value, right, is the health of the provider. And what OHA told us was really during that health check time, you are necessarily in that close proximity. So when you have those two competing priorities or competing values, where they landed is, let's protect the provider for that brief period of time.
Okay.
Once you're going into the childcare, yeah, then I mean, then you're there all day, right, with the kids, and you continue to have those competing values. You're not. Another thing is you're not necessarily in that super close proximity like you would be with a health check. But that's where the health authority landed, and so you certainly can, and encourage you, if you want to wear a mask, absolutely do, but not required, because there's a difference in the proximity and in the competing concerns.
Okay. So I just want to encourage everybody to please put your questions in the Q&A. I'm seeing that people are putting a lot of questions in the chat box, but it's really helpful if we can put them in the Q&A, because then we know how much of a priority they are for everybody, because people can upvote and let us know which ones we should be focused on. So just a reminder to do that. There was a clarifying question being asked, Tammy, about the, what if a director steps into a room but stays 6 feet from the kids? Do they need to have a mask on? So could you go back at that one again, please?
You know, I saw that one pop up in there, and that's when I leaned over and wrote it down in my notebook. You know, the guidance we received from the health authority is floaters must. And so I would say if a director is acting in a capacity as a floater, then they would need to. In terms of the, you know, minutia of what they're doing when they're in there, I would say we have to go back to the health authority and get some guidance on that, and then we'll put it in our FAQ on the website. So I've written it down.
Thanks so much. I just want to,
yeah. Oh, I'm sorry. I just want to jump in too, because I've seen some other things on the masks too.
Yes, please.
Let me add to one of my previous answers, because somebody said, you know, had kind of a comment about that. So in addition to the proximity and stuff, again, think about one teacher with the 10 kids. We've got that stable group, right? And so that's one of the differences too between the floaters, right, and the health check. Like, how many people are you coming into contact with? So that's another difference. So another thing I want to mention, this is about masks and stable groups. It's all of it. when we talk to the health authority, they talk about, there's no one, magic bullet or silver bullet that's going to prevent somebody from ever getting COVID, right? It's all the things taken together gives us the best opportunity of not spreading the virus. So that's why we have stable groups limiting the number of people in interactions. And we have masks for the people coming into a contact with a lot of different individuals, and protecting that staff or doing the health check, and all the sanitation things, and the exclusion rule, right? All of this stuff works together to give us, again, that best shot of keeping the virus tamped down, because there's no one thing that's going to, that's our savior, that's going to take care of everything. That's not how this works. So that's all of this stuff works together.
So we have a question from a licensed program who's wondering how stable groups will work for summer day camps where families sign up week by week.
So Tammy, maybe you and I can tag team this a little bit. I'm going to start out and you you jump in and
I was waiting for this question.
help me out. Oh, are you ready? Do you have a answer?
I mean, I will give it a shot. And if you have it if you disagree or have a different opinion, please jump in. We have to remember that we are not in normal times right now. We're in a health crisis in this country, and we can't operate like we have every other year. So you can't be rotating different groups every week unless it truly is a completely new group of 10 children every single week. And you don't have children carrying over week to week, because then you don't have a stable group. I know in the past and in past summers, that's pretty typical that parents don't want the whole summer. They want to pick and choose weeks here and there, but we're not in normal times right now. So the guidance that I've been giving our licensing staff is that you can't do that unless you are wiping out a group and bringing in a whole new group, but you can't have children coming week to week with new groups, or it's not a stable group. And Amy, if you have a different opinion, jump in.
No, that is exactly what I was going to say. So I'm glad we're thinking the same things. That's right. And all the cleaning that has to go on in between the groups. So it would be very challenging. It's certainly possible. So if you can meet that, great. But Tammy's very right. As we keep saying, these are extraordinary times.
So I just want to acknowledge that Betsy Imholt, our Deputy Director from the Early Learning Division, has joined. And welcome, Betsy. We have a question, I think, for you, which is, could you speak to how ELD plans to use the remaining $23 million from the Childcare Block Grant this evening? So many of us are running with a deficit now, and any funding information would be so appreciated.
Sure, I'm happy to share with you what I know, and I have been listening the whole time. I just now have been able to get in front of the camera, though. So of the 23 million remaining, I'll just back up a bit. So some of you may know that we received $38 million from the federal government in the CARES Act to distribute for childcare purposes, and that's a work in progress. We have 23 million is the number raised in the question, and that is the question at hand. Left to distribute, that number is batted around a lot, and the accounting goes like this: of the 38 million that we have received, 8 million we're distributing right now to emergency childcare grants, and that process is happening right now. We will be doing another round of grants, $10.5 million, and we're working on the information about that I hope that can be going out in the next week. So stay tuned for that. It will not be a secret when it happens. It'll be, we will work really, really hard to get that information out to you all so you can apply for it. And then there's another unknown amount of money, 7 million or more, that may be going for ERDC payments. So that's the part that's kind of the question mark right now, to know how much is going to go for that. So there's still, and all of that does not quite equal the 38 million. So what we know so far is 8 million current round of child care provider grants, another 10.5 to childcare provider grants on the way, and then some for ERDC, a little bit fuzzy on that right now.
Thanks, Betsy. So people clearly have a lot of questions. So about group size, one of our popular questions tonight is, if it's okay statewide to have groups of 25, why is it not okay in childcare? We have the same kids, stable group every day.
Yeah, thanks. So 10 is the number that the health authority came up with. So this comes from, there's some study of COVID, there's some study of other infectious diseases, but the idea in here is, when we're talking about childcare kids in a small room, right? That's one thing. And we know kids aren't like adults, right? They're going to tumble and engage and do all those things. And the adult group or mass gathering, I don't know what we call it in the overall statewide guidance for 25, right? That's a different scenario. So you might be outside, or there are different factors there. But in childcare, you got a pretty small area, you got little kids, and this really is a health authority guidance on what the safest practice. And once again, I'm going to reiterate, right? It's all these things working together to try to keep that virus at bay.
So a little bit different tangent, but I think on people's minds, I think we've seen some of this on the other calls. What should we do about expiring CPR? Most places are not providing classes at this time.
Tammy, could you take this one for us?
Yeah, so when this all started, that was one of the first problems we knew was going to come up. And so there's a couple different things, and I'm not going to have the exact right words because I wasn't expecting this question. But one thing is that we are allowing an online CPR, and on our website, we have some documents there that do have some links to some online CPRs. And then what the guidance documents have said is, once the state of emergency is lifted, you then have 60 days to get the full CPR. Your best option is to get the online by contacting your childcare resource and referral. I know that a lot of them were trying to get their online hybrid courses going again, so that you could do the online now and then do the in-person once those were opened up again. I also know that not every CCR&R across the state offers a hybrid version. So that's your first and best option, because then you're only paying for it once. There's a couple cards that have extended their expirations. And Amy, do you remember, was it American Heart Association that we looked at that had extended it 120 days, and then Medic, the one that the R&R uses for the hybrid, was one of the ones that extended it. So I think that would be helpful if we put that on our FAQ on the website. I'm almost positive it was American Heart Association, but I'm not 100%. I know it was Medic, which is the hybrid one offered through the R&R.
Yeah, and one of the people in the chat indicated that Red Cross had the 90-day extension. So I think what we need to do is we're going to verify which CPR providers have done that extension, and we'll get that up on the FAQ for everybody.
Yep.
Great.
And then in the meantime, you can also, like I said, take an online one to keep you current, and then once the state of emergency lifts, do the full one.
Question around, how are we advising people to do fire drills if we all muster in the same place?
Good question. I actually haven't gotten that question in this entire time. So just, off the cuff, I'm thinking when you do your fire drill, you want to keep your group separate and figure out a meeting place for each individual stable group that'll be a safe place for them, but where they can be separate from each other.
Excuse me. If common areas are outside, do they need to be cleaned between group use? This person in particular is thinking about their outdoor space when they say they're not sure how they would clean stumps and trees. So I think, and I've seen a couple other questions about sanitizing outdoor play structures and those kind of things. So I'm wondering if you could kind of answer a little bit more broadly on this one.
Yeah, I believe what the OHA ELD guidance document talks about is wiping it down. I don't believe it, I don't think it says that it has to be sanitized in between use. Outdoors is hard, and obviously you can't wipe down rocks and stumps and trees. You can do a wipe down on play equipment, on slides, but I do not believe from my memory that you're required to sanitize them in between use.
This is,
That-
again,
No? Do you
just,
remember?
pardon me, go ahead.
Amy, do you remember if that's what the guidance document, actually I have it in front of me. Why don't I just look?
Okay. Perhaps while you're looking at that, this is a related one. Do we have any guidelines on outdoor water play for centers that are open right now?
Yeah, I think Tammy's going to be able to address this one. This is
Okay.
I'm going to let her take this one because I just,
From underneath her. Only on live. Yeah, so this is the document that I'm referring to is the safety procedures and guidance for childcare facilities. And what it says is that you can't use water tables. So you can do water activities where the water is in continual motion, such as a sprinkler, or, you know, a lot of kids out in home environments like to water the plants, but you can't do water activities that are going to have water that's staying stable.
Mm-hmm. Okay. Another question around masks. How often should staff put on a new mask after high contact, after a number of hours? If you take it off, does a new mask need to go on? Are we providing any more specific guidance around masks?
yeah, I don't think we have any specific guidance about that. I think that gets into the realm of a little outside of our expertise and more general in terms of mask wearing.
Mm-hmm.
Tammy, I think, I haven't seen that question before from anyone, so I don't think we've addressed it.
I have not.
Yeah. So we can see if we can find some more general information that's been put out by the health authority or anything on frequency of changing or washing a mask for people who have the cloth ones. We can see if we can find something like that and put it up on the FAQ.
We also had a question about masks for cooks. Have you all had any questions like that? Whether or not people that are cooking in the center should be masked?
We did not receive that guidance from OHA. It would be something we'd have to ask them about.
Yeah.
It did confirm in the document that outdoor play equipment just needs to be wiped down in between groups.
I'm not an expert in this, so this is very dangerous territory, but you know, all the restaurant personnel are wearing masks, so we could probably create a parallel.
Yeah.
Yeah.
I was told by my certifier, oops, I just lost the question, that we're not, ELD isn't, I think the question was that ELD isn't taking any further applications for emergency childcare. So I think it would be helpful just perhaps go over what's going on with application for emergency childcare.
Yeah, great. Thanks for asking that question. I'm not sure where the disconnect happened, but we are absolutely accepting applications from licensed providers to become emergency childcare providers. Like I think I said in the beginning, right, about how you need to be licensed or get the ECC approved to be offering childcare at this time, and that it's a simple application and we turn them around in a couple of days. Yes, we're processing them. Go ahead and do it. There is for providers who are not licensed but are experienced childcare providers. So think about some of the YMCAs, some Boys and Girls Clubs, some other places like that. Some folks refer to them as the pop-up childcares. So we were allowing them for a little while. At this point, the only way we'd accept an application from that kind of provider, the unlicensed experienced provider, would be if they could demonstrate a community need, right? That there's not enough childcare in this area. There aren't any people clamoring to open licensed childcare. If they could demonstrate that, we might allow it, but that's the only case there. But if you're a licensed provider, go ahead and apply and we'll get you approved. Assuming there are no problems, we'll get you approved in a couple of days.
So our license is up for renewal in July, but we've been closed and I've been laid off since March 13th. I've emailed my licensing specialist, but I haven't heard back. Will we get an extension?
So the first thing that you need to do is submit your renewal application. You get your renewal application in timely, which means that we receive it at least 30 days in advance. Then your license won't expire while we work on doing the renewal process. If you've been reaching out to your licensor and you're not getting a response back, I would encourage you to find out who their supervisor is and contact their supervisor, or you can contact me directly and I'd be happy to do some research. But get your application in at least 30 days in advance, and that seals your license so that there's no danger of it expiring.
It sounds like the audio was wonky when you were talking about the fire marshal and the 4-foot barrier requirement. We've had people asking if you could just go over that again quickly.
Yeah, absolutely. Thanks for asking. I'm going to find my own slides, so I am sure to hit the high points. So again, this is for when you want to separate a large room into 2 different rooms, so you can have 2 different stable groups, right? And I'm going to hit, this is a 2-part answer. I'm going to hit both of them just in case I was wonky the whole time. So in terms of the physical setup, you need a secure physical barrier that's at least 4 feet high. In terms of the size of the space, you need at least 35 square feet per child that you're going to serve in each of those areas, okay? Now, you can use the common spaces like the bathroom, the eating area, the outside area, as long as the groups come into those areas at different time and you do some cleaning in between. So the second part of that thing is the fire marshal piece. So what I said was, in normal times, if you were going to erect a 4-foot barrier in a room to separate it into 2 rooms, your licensor would say, well, you have to have the fire marshal come out and inspect that and make sure it's okay. But we also know the fire marshal isn't coming out right now to look at places. So we are working right now on a process. We've been talking with the fire marshal this week to develop a process so that we can work through this and make this work for you all. We will have a process ready to go on Monday. So reach out to your licensing specialist on Monday and they will tell you what you need to do to make this work. But again, we've been working with the fire marshal to come up with a way that is going to be the least difficult or the most, make it the most available to you if you have the right kind of setup, and not be an impediment to you being able to have the 2 separate into the 2 rooms.
I'm noticing that we have a few questions, quite a few questions that have come about people that applied to be emergency childcare but haven't heard and are just worried that it's been too long or et cetera. What would we advise people that are feeling like they haven't heard? How should they proceed to get an answer about their application?
Tammy, do you want to take that one?
I mean, same thing, reach out to your licensing specialist. If you're not getting a response there, contact their supervisor. If that's not working, you can contact me and I'll follow up on it.
Okay, great. So I just want to notice we have about 7 minutes left. One of the things that's being noticed, of course, is that we're talking a lot about the Oregon Health Authority because the Early Learning Division has worked very closely with them. There's an impression that other businesses are being allowed to open fully. Why is childcare being treated differently?
Well, I would say that most businesses actually are not allowed to be opening fully. So we see in the restaurant and bar industry, they have a whole sector guidance plan for them. Retail has requirements about social distancing and some other provisions they have to take care of. So gyms, all kinds of places have their own sector guidance. People familiar with summer camps have their whole sector guidance that they need to be following. So we are not unique by any stretch. But another thing I will say is that childcare is somewhat different from a lot of those other places because we're dealing with little kids, right? And little kids being who they are, and hugging and playing and maybe not having, wiping their nose on their sleeve, or all the things that kids do, right? So we are alike many other industries in that there is a lot of restriction, regulation, direction. And we are unlike a lot of other places because we're completely focused on little kids, and they're just different than us adults.
It seems like it would be helpful to people if you could talk a little bit about what would qualify as a room divider. Like what is a 4-foot barrier? What might a 4-foot barrier be made out of? We have a number of questions that are really inquiring more about the barrier itself.
Yeah, Tammy, could you help us with this? I know we've been working on the barrier thing and some different in both CF and CC for a little while.
And I'll try. And what I can tell you is that your licensor is going to be the best source to problem solve that with you, because they're familiar with their space, your space, and they're also getting ideas from other programs and what they're doing. I know a lot of people are using things like furniture, bookshelves, cubbies, things that they can, line up across. I've seen some people build kind of a frame and then put cloth, like staple cloth over the frame to use as the barrier. So those are the most common ones that we're seeing, is using furniture, cubbies, shelving, and then building a frame. But again, your licensor is talking to a lot of programs, so they might have a lot of great ideas too that they're seeing and hearing that I haven't thought of.
Yeah, and if I could just add on to that, Tammy, if you all think about, there are probably 100 different things that can happen. Here's the goal. We want to keep those two separate groups truly physically separated. So you can't just put, tape or a little, rope or piece of yarn across an area, because little kids are going to move back and forth, and that's what we want to prevent, right? And so prevent that crossing of the kids, then you're headed in the right direction.
And the other thing that we did hear when we were talking to the fire marshal this week is that cloth barriers are good in terms of if you can secure it so that children can't push their way through. So like I was talking, putting it on a frame. But the fire marshal doesn't like to see vinyl or plastic because of the flammable and the melting, and it's just more of a danger than cloth is.
Okay. We have asking for clarification. Is prioritizing essential workers still our first priority, or can we start letting, in quotes, regular families return?
Yeah. So I would say this is a yes and. So since the beginning, it's been prioritized, that essential workforce, Again, a reminder, the essential workforce is incredibly broad. It's not just doctors and nurses and other medical personnel and police and firefighters and grocery store workers. There's a huge list on our website, and it's a huge sector of the economy, really, that's in the essential workforce. So you might be surprised about your families, wherever they work, it might be part of that. But even if they're not, the direction has always been to prioritize them. And then in the new guidance that came out about 2 weeks ago, it also said you can start sort of welcoming back your other families, other folks who are going back to work. So we've never said you can only exclusively serve the essential workforce. So yes, you can be opening up to more families. If you've got some open spots and you want them to get filled, absolutely, and invite back your families, and you can move beyond essential workforce, as long as, what we want to make sure is that those folks on the front lines have the childcare they need for the incredibly critical work that they're doing.
So I think this is going to be our last question that we're going to answer live, and then I'll talk a little bit about what's going to happen to that. So we're a licensed childcare. We offer summer camp in the summer. We understand that because we are licensed, we would have to apply for emergency childcare if we want to offer camps this summer, unless things open back up. Is this correct?
It is correct. If you are a licensed program, in order to do any sort of program, you need to be approved as an emergency childcare.
All right. Well, I want to thank our panelists very much tonight, Amy and Tammy and Betsy. Thank you very much. I want to thank all of our attendees. I know all of you have very busy days and very busy lives. Thank you very much for joining us. I want to let you know that our slides from this presentation will be available. I'm so sorry that we ran into a little technical snafu, but our panelists were great and really did wonderful with that. We do have a super quick poll that I am gonna put up. If you all wanna take a minute, we would love to know more about how you're getting your information about requirements for emergency childcare. So please give us your votes on that. It is our intention for us to continue to host these calls into, into the future. We're putting a schedule together for next week, and we'll be communicating about that tomorrow. And then we will be working on the questions that we weren't unable to answer tonight. We'll either carry those forward, or if we had a lot of folks who asked specific questions, we will look at getting responses to those in our FAQs on the website. And I'm gonna close the polling now so that people, and here are the results. Anything else before I close, panelists?
I just want to say thank you to everybody for taking some time out of your evening and coming and joining us. Please continue to join us. Please get us your ideas. I meant it before when I said I want this to be a conversation where we're receiving your ideas and working through this together. We know this is challenging, and we really appreciate the care that you're giving to Oregon's youngest children. Thank you.
Good night, everyone.